So it's the role of a nurse navigator. It's kind of multifaceted. Our roles actually exist to pretty much make sure patients get timely access to care services and treatment. So the nurse navigators must understand their own program's process for biomarker testing and work with the multidisciplinary team to make sure that it's happening sooner in the process as opposed to later. Best to have those results available for the medical oncologist. And so finding a way to work with pathology and work out the logistics of send out. And then, of course, comes the not only working with getting the tissue out, but then making sure that the documentation is appropriate for the send out, because insurance companies need ICD-10s that they're going to cover. And so it's really important that you understand what those look like from a billing perspective. And then making sure that patients' appointments are timed in such a way that it's not a wasted appointment when they come in to talk about their treatment plan, but those results are actually in the hands of the medical oncologist who's about to provide them with that treatment plan. Then looking at barriers to care. We've talked a couple times that if we don't have a sufficient sample, that we may have to resort to doing a liquid biopsy. So in order to do a circulating DNA, some of the companies actually will send a phlebotomist to a patient's home. Sometimes they need to travel back to the institution. And if they're coming from a distance, being able to kind of coordinate that care and save them a couple hours of travel time for the lab test. Patient education is huge again, kind of making sure they understand everything that goes into not only the process and what's involved from getting their tissue to the lab and how long it's going to take, but then making sure they really understand how important it is into developing their treatment plan, and then helping them manage the stress. The waiting period, as I've alluded to in the past, is very daunting for patients when they know they've got a cancer diagnosis. And so being able to help fill that wait time with educational resources or information that not only sets them up and prepares them for shared decision making when they come in with their medical oncologist, but also helps to kind of identify some of their goals of care.